All right, so welcome back to the 13th Annual Air Quality and Health Workshop here in Vancouver, here at the Sheraton Vancouver Wall Centre. My name's Chris and I'm with the Lung Association here in British Columbia. And with me right now is Dr. Melinda Power. She's the assistant professor at the George Washington University, and she is giving us a talk today on mental health. So let's get right to it.
Sure.
What is the burden of mental illness?
So mental health disorders are a huge burden globally. Approximately 1 in 5 people will have met criteria for one in the past year, and about 30% will experience a mental health disorder in their lifetime.
Wow.
And they can be incredibly disabling. Not necessarily a huge source of death, but a huge source of disability in the population.
Wow. And what are some of the risk factors of mental illness?
To be honest, we don't have a good handle on risk factors for mental health disorders. We know that they're more common among socially disadvantaged groups, among people with traumatic experiences, among people with chronic diseases. They're more common if you've had another mental illness or another mental health disorder, or if you have a family member who has one as well. And so understanding risk factors for mental health disorders is really important because we'd really like to find ways to prevent them moving forward.
Right. And the million-dollar question today is, what about air pollution? How does that affect mental illness?
So you might at first glance think air pollution, mental health, that doesn't make much sense. But there's an emerging body of evidence that really suggests that these two may be related. This idea that mental health and air pollution are related has been around for a while, but up until about the past 10 years, people have focused on the idea that maybe your awareness of your air pollution leads to some sort of distress. You're worried about it. But you know, in the United States and in Canada and other places where you've done a fairly good job lowering air pollution, that's not really going to be an important mechanism.
Right.
People aren't generally aware of their air pollution exposures. So then we go to look at more mechanistic causes. So there are a lot of studies in the toxicological literature and the animal literature that suggest mice and rats who are exposed to high levels of air pollution do things that look like depression or anxiety in a mouse or a rat, which is a little bit difficult to translate, but it's highly suggestive. We also know that air pollution contributes to inflammation, oxidative stress, and a lot of mental health disorders have a lot of inflammation, oxidative stress associated with them, either in the body or in the brain.
Okay.
We also see that air pollution is really considered a causal risk factor for a variety of cardiovascular and respiratory diseases. And people who have these disorders are more likely to have a mental health disorder as well. In addition, air pollution may exacerbate symptoms of cardiovascular and respiratory diseases that you might interpret as feeling anxious or feeling depressed. And finally, there is some evidence that air pollution can actually impact either the stress response or neurotransmitter levels in the brain, both of which are very important in mental health disorders.
Of course. And the other thing that's been floating around there a little bit is there a relationship between air pollution and the sensitive topic of suicide? What have you found in that realm?
So I personally haven't studied suicide, but there are a couple of studies out there. And what they do is they look at whether suicides are more likely to occur on days when air pollution is high, or maybe the day or two after air pollution is high. And generally they do find a correlation, but there's a lot of unknowns, right? The air pollutant that they find to be correlated with suicide rates is a little bit inconsistent across studies, or which subgroups or what time of year is most important. Again, these kind of studies are very suggestive, very interesting, but they're all looking at rates of suicide. They're not looking at whether someone actually commits suicide or not, and that would be an interesting case.
Absolutely.
What we do know is that there's also some suggestion air pollution may influence anxiety symptoms, depressive symptoms, symptoms of mental health disorders that may contribute to suicide. Although again, that literature is really in its infancy, and we're going to have to wait and see if it holds out in the long term.
I mean, a lot of fascinating things there. Unfortunately, we're out of time for this right now, but obviously for a lot more detail, we're going to have your deck on our website, and we can't thank you enough, Dr. Melinda Power, for being here with us to do this. And that's it for now.
Thanks so much.
Yeah.